Good morning, my dear students. Today I will discuss regarding the infertility, new topic regarding the sex offense chapter, infertility. It is very important for forensic as well as for the gynecology. And in this class, very meticulously, you have to listen that you are able to understand in gynecology also as well as in the forensic medicine. So, all these things are very important for the medico legal aspects as well as for the purpose of clinics. Now, regarding the infertility, we have to know some definitions. Without definition, it is not possible to understand. So, everywhere the definition is necessary in this chapter. First, you have to know the impotence and sterility. So, within the infertility, both things can come, impotence as well as the sterility. So, first you have to know that what is impotence. Impotence definition is very important. In the practical class, I have taken regarding the accused examination, victim examination in sexual assault cases or rape, and in that class I have discussed what is the definition of impotence. So, impotence means inability to perform the sexual intercourse in case of male. So, it is the inability of a person, male person, to perform the sexual intercourse. Impotence usually not associated with the female. So, this language is associated with the male partner, whether he is able to perform the sexual intercourse or not. If he is able to perform the sexual intercourse, means he is able to erect his penis or perform the sexual intercourse, he is potent. And if he is not able to erect his penis and not able to perform the sexual intercourse, subsequently he is impotent. Now, what is sterility? Sterility is the language comes for both the male as well as for the female partner. So, sterility, a person or male person may be sterile or a female person may be sterile. So, the sterility is the language which in terms applicable for the male as well as for the female partner. Now, I have already told what is the definition of impotence. Now, what is the definition of sterility? So, in case of male, the sterility is defined as it is the inability of a male person to beget the children, and in case of female, the sterility is defined as it is the inability to conceive the pregnancy, to conceive. So, it is the definition of sterility. So, in case of male, the sterility means inability to beget the children, and in case of female, to conceive the pregnancy or to conceive it. It is called the sterility. Now, what is infertility? Infertility means it is the inability to conceive following unprotected sexual intercourse. So, very important is the unprotected sexual intercourse. If a couple, they are not using any kind of protection and they are performing the sexual intercourse unprotectedly, if the couple age is less than 35 years and 1 year they are performing the unprotected sexual intercourse, but the male is not able to give the birth of the child or to beget the child and the female is not able to conceive, it is infertility. And after the age of 35 years, if the couples, they are performing the sexual intercourse unprotectedly for the 6 months time, in spite of this they are not able to conceive or beget the children, it is infertility. So, according to the age, the infertility definition is different, whether the age is below 35 years, whether the age is above 35 years. That's why the infertility is defined and to categorize into two types. One is called the primary infertility and the secondary infertility. Now you have to know regarding the frigidity. What is the definition of frigidity? Frigidity means it is the inability to initiate or to maintain the sexual arousal pattern on the female partner. So, it is the inability of a person to initiate or maintain the sexual arousal pattern to the female partner. It is called the frigidity. Means the female partner is not able to maintain and initiate her sexual arousal. She is not able to sexually arouse. That is called frigidity. Next, we have to know the definition of marriage. It is very important. What is the definition of marriage? Nowadays, you are watching the social marriage, but legal definition of marriage is very important. Legally, the marriage is defined as it is a contract between a male partner and the female, which implies the physical union in the form of coitus or intercourse. So, it is a contract between a male and a female person which implies the physical union in the form of coitus. So, marriage means there is physical union between the male and the female person, nothing else. So, the law is giving the permission legally to contract between a man and the woman to perform the sexual intercourse. That is the legal definition. If the male partner is not able to perform the sexual intercourse, means there is no consummation of marriage legally. So, marriage is consumed means the male partner is able to perform the sexual intercourse, but if the male partner is impotent, means is not able to perform the sexual intercourse, then the law is saying that the marriage is not consumed, means the marriage is not validated. So, in that situation, the female partner may file the divorce. So, the divorce means the dissolution of the previously valid marriage. The dissolution of previously valid marriage. So, if the marriage is valid, means legal marriage is there, then the dissolution occurs in several grounds. That's why the divorce may happen, and one of the important causes of dissolution of marriage is the importance. Other causes I will say. Now, the sexual acts comprise of three components, very important thing. If a person or male person is going to perform the sexual intercourse with his female partner, its components are three types. One is called the erectio, means erection of the penis first is required. Next is called the intromotio, means the introduction or introduce the penis to the vagina. Next is called the ejaculatio, means ejaculation into the genital tract. It is three components are important to performing the sexual intercourse or any sexual act. So, erectio, intromotio and ejaculatio. Next, vera copula implies the consummation of marriage means penetration. So, it is the language where it is written that the marriage consummation occurs means that there is penetration of the penis into the vagina. Then we can say that there is consummation of marriage. Next, high sex drives. The high sexual drives may be present in male, may be present in female. If a male person is or having high sexual drive, it is called satyriasis. It is called satyriasis. Those male person who have the excessive sexual desireness, excessive sexual drive, basically they are called the satyriasis. And in case of female who have excessive sexual desire is called nymphomania. is called nymphomania, means the female partners having excessive sexual desire or drives. Next, what is called ejaculatio precox, short note, ejaculatio precox, or in the Viva question, the examiner may ask, what do you mean by ejaculatio precox? Ejaculatio precox means premature ejaculation, means just immediately before the introduction of the penis there is ejaculation, or just entering into the vagina of the penis immediately there is ejaculation. Usually the normal procedure is you are performing the sexual intercourse for 5 or 7 minutes, after that there is ejaculation, that is the normal. But in case of ejaculatio precox, premature ejaculation, immediately before the introduction of the penis or just penis is introduced, at the time the ejaculation has happened. This is called ejaculatio precox. Now the very important question regarding this impotence and sterility. What is the legal issues? Why we are studying regarding the impotence and the sterility? So there are some legal issues. So in case of civil cases like the nullity of marriage, there will be the nullification of the marriage, divorce or divorce, I have already told. So in this question the impotence and sterility is very important. Disputed paternity, in the situation whether the person is sterile or not, whether the couples are sterile or not, whether the male person is impotent or not, you have to ask, you have to thoroughly investigate the case. Legitimacy, whether the child is born, whether the child is legitimate child or illegitimate child, in that situation you have to know. The suites of adoption, if the person is not able to perform the sexual intercourse or is able or they are able to perform the sexual intercourse but they are sterile due to lots of causes. So in this situation the suites of adoption of the child is a big question. Next is the supposititious child. I will discuss what do you mean by the supposititious child. Next, in criminal cases like the adultery, like the rape, I have already discussed during rape whether the male partner is impotent or not, that is very important question and you have to examine the person. Unnatural sex offences, in case of compensation for the impotence, blackmailing and defamation cases, all these criminal cases the impotence and the sterility play the important role in the code of law. Next, the nullity of marriage or divorce can be legally claimed. When legally the divorce can be claimed, incapacity existing, whether the person is impotent and the incapacity is performing for the long duration. It may happen that the person is impotent for a short period of time due to the depression, due to the some emotional causes, stress factors or some disease process, acute causes for which the person may be impotent. But if the incapacity is persisting for the long time, then there is a question of divorce. Then the incapacity permanent and incurable, whether this incapacity are permanently, means the permanently the person is suffering from some diseases for which the person is not able to performing the sexual intercourse, and the disease is incurable, cannot be cured. In that situation, the female partner may file the divorce in the court of law. Now, that is very important, that is why I have written here, explain why, write down the explain why question. Impotency is the ground of divorce, or impotence is the ground of divorce, not the sterility. Why? Now I am explaining why. So impotence is the ground for divorce, very important, explain why, and it should be given in the theoretical examination as well as the university examination too. How you will write the answer? So impotency is the ground of divorce, not the sterility. So here the important key words are impotence or impotency, divorce is the important word and the sterility is the important word. So in that case you have to know the definition of impotence, you have to know the definition of divorce. So if there is divorce, so definition of marriage is required. So here you have to add the marriage, A-R-I-A-G-E. So you have to know the marriage and what is the definition of sterility. If you know this 4 definition, then the answer will be completed. I have already told that divorce is not occurring due to the sterility, because a person is able to perform the sexual intercourse or potent but may be sterile. A lots of couples are there. Like the 10 to 15% couples, they are suffering from infertility or sterility involuntarily. It does not mean that the male partner is not able to perform the sexual intercourse. So they are able, means the male partner is able to perform the sexual intercourse, but either the male person is suffering from sterility or the female person is suffering from sterility. But the sterility is not the ground for divorce. Whether the consummation of marriage has occurred or not, that is the question in the court of law. The judge will ask whether the marriage is consumed or not, means whether the person is potent or not. If the person is potent and able to perform the sexual intercourse, in spite of this the female partner is asking the divorce, this ground that is not valid. So, if the male person is impotent, then the divorce can be given, can be taken into consideration, otherwise not. Now, what are the causes of infertility in case of male? So, what are the causes of infertility in case of male, female and etc. So, in case of infertility means the couples, those who are infertile, 30% males they are infertile. 30% male they are infertile, 30% females they are infertile, combined 10%, unexplained 20%, or others are 5%. So, in infertility, just understand the 30% male, 30% female, 25% unexplained. So, consider these things why the infertility are both the responsible partners. They are responsible, both the male as well as the female. Now, the male infertility. We are discussing regarding today's class regarding the male infertility. See, what are the causes of male infertility? Male infertility disorders. So, first is the semen. So, seminal disorder I will discuss later. Next is the testicular failure. So, see the seminal disorders in the 10% where there is infertility. Testicular failure is the 9% responsibility of the infertility of a male person, others are 7%. Obstruction in the pathway is responsible for 6%. Cryptorchidism is 6%. Varicocele of the male partner, varicocele of the testis is 37% involvement in case of male infertility, and idiopathic means there is no explanation behind it, it is almost 25%. So, see varicocele is the important culprit, important cause of male infertility, and 25% is idiopathic, that cannot be explained. Now, the causes of male infertility. See, the male age usually we are saying that the infertility or the age above 70-80 years also the male partner can able to perform the sexual intercourse. Even the 6, 7 or 8 years boy is also able to perform the sexual intercourse. So, in that case there is no restriction of the ages. Structural or the hormonal disorder. So, what are the structural disorder of the male partner which leads to the infertility basically? So, like the undescended testis. So, see the abdominal position, then the inguinal, then the scrotal area. So, if the testis is present in the abdomen or in the inguinal canal or obstruction, so that there is no further descent of the scrotum, within the scrotum the testis is not present. So, that leads to the infertility. Next, the hypospadias. I have already said hypospadias means the urethra is situated just the ventral surface of the penis, not at the tip of the penis, and that type of hypospadias may be glandular, may be coronal, may be mid-penile, may be scrotal, may be perineal. So, if the urethra is over the perineal region or the scrotal region, then there will be ejaculation outside the vagina. In spite of this, there is the introduction of the penis into the vagina. So, the penis is introduced within the vagina, but the urethra is situated surrounding the scrotum or the perineum, so that during the ejaculation the semen is not entering into the vagina and there is no conception. Testicular damage caused by mumps. So, mumps orchitis is very important one. Those male partners who are suffering from orchitis, testicular orchitis due to the mumps, and that leads to the infertility of the male person. That is why all the male partners, they are advised that to take care regarding the testes, so that the testicular infection will be minimized. So, the mumps is very culprit for this testicular orchitis or testicular disease or orchitis. Varicocele is very important and low testosterone level. So, the spermatic cord, tortuosity of the spermatic cord is very important, that leads to the varicocele, and the low level of testosterone that leads to the infertility. Next, some abuse, substance abuse, like the male partner, those who are taking the heroin, those who are taking the marijuana, gaja, choros, narcotic drugs, all these things they causes the decreased spermatogenesis. So, the sperm production will be decreased. Those who are taking the butyl nitrate, amyl nitrate, all these things, they are the antihypertensives. So, in that situations the persons may feel infertility. Decrease in the sperm, like due to the hypopituitarism or some chronic debilitating disease process or some tuberculosis or malnutrition or due to the trauma to the spinal region, most commonly over the lumbosacral region, if there is any trauma or road traffic accident, that leads to infertility. Decreased libido means sexual desireness, like the heroin or methadone, those persons who are taking selective serotonin reuptake inhibitors and the barbiturates, this causes infertility. Impotence occurs in case of alcohol. So, those persons who are taking the alcohol for the long time, it leads to impotence. And some local disease, So, that is why one funny pictures I have taken, that how there is a mutation of the sperm. The boy is saying, it is not a balloon, it is my mutated sperm, and the girl is asking that, what a funny balloon you have. So, if the balloon is like these things, so balloon is not a perfect balloon, means the sperm is not perfect, then there is the mutation of the sperm, that is why it looks like this. Causes of male infertility. So, obstruction, lesion in the epididymis and the vas deferens. I have already told the obstruction over the pathway. So, the obstruction in the epididymis as well as in the vas deferens, that leads to the male infertility. Next is the nutritional causes, means the nutritional deficiency, and other factors like the genetic disorder, other the endocrine disorders like the diabetes mellitus, psychological disorders is very important, and that is short question. So, remember quad hoc, impotence quad hoc. The short question is given quad hoc or impotence quad hoc. What does it mean? The psychologically, it is a psychological disorder of the male person, that the male person is not psychologically sound to a particular girl. So, he is not able to perform the sexual intercourse with the particular girl, but he is able to perform the sexual intercourse with other girl, because he has no feelings psychologically. He does not want that girl to perform the sexual intercourse with her. So, it is called impotence quad hoc. This is the psychological disorder, that he is not able to accept mentally to perform the sexual intercourse with that type of girl or with that particular girl, but another girl he is able to perform the sexual intercourse. It is called the impotence quad hoc. Next, the sexual transmitted disease like the STDs. Next, the exposure to the scrotal to the high temperature. If the scrotum is chronically exposed or for a long duration of time, the scrotum is exposed in a high temperature, then there will be chance of varicocele. There will be chance of decreased spermatogenesis or azoospermia. So the scrotal bath is very important advice, so that the temperature is to be maintained and there will be spermatogenesis subsequently, because within a fixed temperature, within a definite temperature setup, the spermatogenesis is happening. Next, I have already what is the satyriasis and what is the nymphomania. Next, assessment of male infertility. How will you assess the male infertility? So you have to ask these questions, you have to examine the patient regarding these factors which I have discussed. Now how will you assess? So first you have to perform the urinary test, gonorrhea, syphilis, STDs present or not. Semen analysis, complete semen analysis, that is called seminogram. So seminogram or semen analysis is very important, whether the sperm is present or not, what is the quantity of the sperm per ml, what will be the criteria to perform the sperm counts, what is the motility of the sperm, what is any abnormality of the morphology of the sperm or not, what is the content of the nutrition of the sperm in of the semen that is present, means the zinc, glucose, all these things are present sufficient amount or not. All these things are important for performing the spermatogenesis, and whether there is any morphological disorder, motility disorders are present or not. Most of the cases it is seen that the sperm motility is decreased. So must the 50% motility of the sperm is necessary. So you have to know these things. Next, the FSH and LH and testosterone level, T3, T4, T6 means the whether the sperm is suffering from hypothyroidism or not. Test for sperm antibody, whether the sperm antibody are present or not. If the sperm's antibody is present, then the sperms will be distracted. Next, the 17 hydroxycorticosteroid and 17 ketosteroids, and buccal smear of chromosome study like the Klinefelter syndrome and the XXYXX chromosome disorders. So the Klinefelter syndrome, you know that the chromosomal disorder, so you have to know these things. Next, the ultrasonography, USG. USG is very important, and testicular biopsy. So the testicular biopsy is very important, whether the testis is normal or not, whether the testis is able to generate the normal sperm count or not. So this is very important. Next, the history, physical examination, complete physical examination you have to do. Next, the genital tract examination, assessment of the penis, urethra, scrotal size and the position of the size, consistency of the testis, epididymis and vas deferens, prostatic size and consistency. All these have to done, because any kind of abnormality that leads to the infertility. Next, the varicocele with the man, both the supine and the upright position, you have to examine the varicocele is present or not. I have already told the seminal analysis or seminogram. Please understand these things, the normal semen, how it looks and what is the content of normal semen. Usually volume is 2 ml or more. So per ejaculation the volume is 2 ml. Sperm concentration will be per ml 20 million or more. So if it is 2 ml, so 40 million sperm must be present. Total sperm count I have already told 40 million. Motility 50% forward progression, I have told the 50% progression will be there, 25% should be the rapid progression. Viscosity, liquidification or liquefaction in 10 to 20 minutes. Morphology, 30% or more sperm would be normal. pH of the semen should be present 7.2 to 7.9. WHO means that WBC means the white blood cells count should be less than 1 million. See the azoospermia, no sperm in the semen. Oligospermia, there means few sperm in the semen due to the genetic disorder like the varicocele or endocrinopathies or genetic causes. Abnormal volume means no ejaculation. So if there is no ejaculation means there is any obstruction or there is retrograde ejaculation due to the hypogonadism. If the semen is low volume, then we have to ask for whether the obstruction is the vas deferens or in the ducts of the pathway, or there is the absence of seminal vesicle, or there is retrograde ejaculation, or there is any infection or not. If there is abnormal motility or it is called asthenospermia, then you have to know that whether there is some immunological factors, means the antibody are present or not, and the sperm structures you have to know. And abnormal morphology I have already told, that is the varicocele, stress and mumps orchitis. So, this is very important, very important things you must remember. And see the structures, the sperm trying to enter into the ovum, and if there are no motility, means the motility power is decreased, so not able to enter, and if also that the health or the strength of the sperm is not sufficient, then also they are not able to penetrate. Next, if the semenogram is abnormal or semen analysis, I mean semen analysis is abnormal, then you have to go for the lab test, means laboratory test, and ultrasonography. I have told the ultrasonography and transurethral ultrasonography, so that we are able to see the size shape of the prostate, seminal vesicle, that is very important. Next is the bulbocavernous reflex test and erectile capability test with the help of papaverine injection. So, we are injecting the papaverine so that the person is able to erect his penis or not. So, the sexologists, those who are working, they are trying to test whether the erectile functions is normal or not. If the person is not able to erectile, they are trying by bulbocavernous reflex test and the papaverine injection, and after that whether the penis is erected or not, they are trying to do these things. So, up to this we are finishing here. Thank you regarding the male infertility.